Welcome to another episode of the JPN podcast. Today we'll be discussing treating suicidal patients. Now, there's a lot of moving parts to the context of this video, so I just wanted to share a bit. It really all starts from the Beis Medrash for Medical Halacha. They've curated a series of pamphlets on various topics of Jewish medical ethics. Specifically, Rabbi Sprung has curated these pamphlets, and they're really well worth reading. They're fantastic pamphlets that cover a variety of topics, and they're really worth going through. And a link will be provided in either the description of this video or in the PowerPoint with this video. However, the best optimization of these pamphlets is really to have in-depth discussion about them. So we as the JPN have partnered with the Beis Medrash for Medical Halacha and have provided those in-depth discussions. We've done one of these before with Rabbi Fogel. If you go to our YouTube page, I'm sure you can see that video. That one's more of just a synopsis of the pamphlet. Today will be a more practical application and in-depth analysis. However, this is really the best way to gain the most of these really fantastic pamphlets. Lastly, you may have gotten this video in preparation for our large CME event. So after having these pamphlets put out and after the JPN has discussed these pamphlets, we realized that the best thing we could do is really offer a continuation of this discussion. So the JPN with the Beis Medrash in conjunction with Touro University and New York Medical College will be offering a CME accredited event, furthering this discussion into the realm of practical application in terms of the role of the Jewish physician in end-of-life care. So now that that's all cleared up, what is the JPN? So the JPN stands for Jewish Physicians Network. It's an organization started by myself, Mark Gans, and my co-founder, Menachem Jacobs. Our goal has been to provide support and education for the Jewish physicians in all stages of training, while also addressing public health concerns that face the Jewish community. I'd like to take a moment to really thank Menachem for his tremendous work on all our videos and all our content, and especially in regards to today's discussion. He put a lot of time and effort into helping curate the PowerPoint, and I just want to take this opportunity to thank him. So with that said, let's begin. So we felt that the best way to have this discussion is to go through a real life case, because this is how it's going to present in real life. So that being said, this case was posted in the New England Journal of Medicine. So a 58-year-old woman presented with headaches, weakness, and stroke-like episodes. Just a caption from that article. Despite these interventions, she requested consistently that all life-sustaining treatments, including insulin therapy, be discontinued and that she would be allowed to die. Her family supported her request, and a psychiatric consultant determined that her decision-making capacity was not compromised by depression or confusion. She was transferred to the palliative care service and died with her family at the bedside 3 weeks after admission. An autopsy was performed. So here we go. We have a 58-year-old woman with headaches, weakness, and stroke-like episodes. And eventually she just opted out for care. She didn't want any life-preserving measures. And so this is really where this topic begins. You have a patient who doesn't want to continue life. What is your role from the physician? And our discussion is really going to be from both perspectives. What is the role in terms of like, what's going on from the patient perspective, from a Jewish patient perspective, and what's the perspective from a Jewish physician's perspective? We thought it was important to list the differential diagnosis. You can really see here that it was a wide range of what was going on. They were suspecting anything from MS to a vasculitis to lacunar infarcts. And the reason we put this up there and the reason why we felt it was important is because, as you'll see through the sources we bring down, when it comes to suicide and end of life, sometimes when we quote the texts, it seems as a very black and white discussion, the do's and don'ts. But that's very rarely the case in practice. Patients are going to present, and there's so much context with which this patient is suffering, and there's so much that the patient is going through. And with that said, what we do in practice is guided quite a bit by what that patient is going through. So today's discussion is an academic discussion and a little bit of how that will implicate itself practically. But it is important to consider that a lot of times when we have these discussions, we discuss things in black and white. because we're discussing the academics, but the reality is, as you can see, there's a large differential here. This patient had a lot going on, and there's a lot of context to the patient who's actually in front of you. So that being said, we have a patient in front of us who doesn't want to continue to live. And the question is, from the patient's perspective, what's going on? You know, what is suicide, and what, in terms of a Jewish perspective, how does the Jewish philosophy approach suicide? So this is a quote from the Rambam, Maimonides, who lived in the 12th and 13th centuries, and he's going to quote the Talmud, the Gemara, which really brings down the biblical verse as to how we know that suicide is not allowed in the in Jewish law. So the second paragraph, it says, the verse continues, of the blood of your own lives I will demand an account. And this refers to a person who commits suicide. So Maimonides is bringing down just a very clear black and white source. Suicide is not allowed. Now, as I mentioned, sometimes in the sources it's black and white, but in reality it's a little bit different. So it's important to note here that more modern sources that talk about this topic, where a lot of questions are often posed to some pretty big rabbis as to like what to do in a case where someone committed suicide. Usually what they'll do is they'll evaluate the case and point out that there's a lot of gray area and the patient was suffering, and it's never usually this black and white. So usually, like, going backwards, when they're presented with the case, they'll often show how it wasn't necessarily suicide. But from a very strict academic perspective, suicide from a Jewish perspective is not okay. So that being said, you have a patient who, from their perspective, is not okay, is doing something that's not okay. So the question is, you as a provider, what is your role now in terms of intervening? Do you have to intervene to help this patient not do something that's not okay? And, you know, for simplicity's sake, right, let's say this is a Jewish patient who shares the same values as you as a Jewish provider. What is your role now? So on the right side of this slide, there's text from the actual case that's brought within the journal. And it's important to realize that obviously from both from a secular and Jewish perspective, we have to do our due diligence and make sure that the patient is not making a decision based on clinical depression or anything of that nature. So this is just a little snippet of what they wrote in regards to like the assessment of this patient and how they explained. You always have to explain everything that's going on. And that's obvious both, like I said, from both perspectives, both a secular perspective and from a Jewish perspective. But the question we have today, and the question we're going to try to address, is what does the Jewish physician have to do? What is the obligation of the Jewish physician? And not just that, can we quantify that? How far do you have to go? If, let's say, we state there is an obligation, do you have to lose your medical license over it? What about violating HIPAA laws? Can we quantify the exact measures that a Jewish physician has to take in this scenario? So with that being said, what we have to really figure out now is that we brought down the verses that describe that suicide is not okay. But as the physician, you're not the one committing suicide. What is your responsibility? What are the verses and what are the core obligations that you have as a physician? So again, we bring down the Gemara. This is a Talmud bringing down the two biblical verses for someone to stop death. And so the first one is a bit more straightforward, and it's like the fourth or fifth line. It says, "Do not stand idly by the blood of your fellow." That's the biblical verse. This is the Talmud bringing down the biblical verse that says that you have to not stand idly by the blood of your fellow. And what that means is you can't let your friend die, at least at face value. That's what that means. And the second verse, which is interesting, it really comes from the verse of, I think it's like 4 or 5 lines up from the top paragraph, 4 or 5 lines up in the English. It says, "And you should return it to him." And that's a reference to the verse that says that when you have a lost object, you should return it to him. And so it's an interesting verse to be learning, saving someone's life. And what we're saying is the comparison is the same way you would return an object, you have to return that person's life. And like I said, that's a very strange thing at face value, but it's gonna really play out. We'll discuss it in the next slide. The reason why this is so important is because when we learn our obligations from specific verses, what that means is they have the guidelines as the verse we're learning it out from. So what that would mean in this case is that in the way that when you return a lost object to someone, you don't have to go ahead and go out of your way and hire workers to return that object. That would technically mean that when it comes to returning someone's life, same thing. You don't have to go the extra mile and hire someone to help save this person's life. So it's guidelines like that that make it important to understand where the biblical obligation comes from. And like I said, it is a bit strange that it seems to be coming from returning an object, but I think we'll touch on that quite nicely as to why that may be the case. So the Minchas Chinuch, Rabbi Yosef Abad, lived 1801 to 1874, wrote extensively on the obligations that we have and the sources for those obligations. And with this, what he quotes is that the obligation to save someone's life is, in the case specifically, I would like to clarify, this is all in the case of someone, giving away their life in a sense. This is specifically in the case of suicide. This is not the laws of just saving someone's life in general. So again, so this is the source of how we know you have to return someone's life. And so he says it's from the verse that you have to return an object to the person. And with that said, he actually elaborates that the same way you wouldn't return an object to a person when the person doesn't want that object. So if you see a lost object on the ground and you know that your friend who lost the object would want it, you have an obligation to return it. If that person threw it there, clearly doesn't want it, you don't have to return it to him. And so he elaborates that because this is the same verse that we learn about, returning someone's life to them in a way. If someone's throwing away their life, you don't have to return it, because it's the same concept, same guidelines. When it came to the lost object, you didn't have to return it because the person threw it away. Same concept here. If the person's giving up their life and they don't want it, you don't have to be more stringent on their life than they are, and you don't have to return it. And what this really stems from is that what he's trying to say, in a way, what we can extrapolate from this is that the obligation to return someone's life is an obligation you have to that person. It's between person to person. So if you don't want it, I don't have to return it to you, because that's the obligation of saving someone's life here. And that's important because as we're going to see, this is not the widely accepted notion of saving someone's life. So that being said, it's very clear that he's saying in this context, if someone doesn't want their life, i.e. in the case of suicide, you wouldn't have to do anything. So if we were going like Rabbi Yosef Abad, that we're learning it from this verse, what would come out is in our case, our patient who doesn't want to opt for life, there's nothing to intervene. However, that's widely contested, and that's not generally the viewpoint we take on when we think about the Jewish perspective of saving a life. And so we have the Radvaz. Radvaz lived in the 15th and 16th century. He was the leading posek and chief rabbi, and he wrote a lot of responsa. So he wrote his, Jewish ethical decisions in response to questions that were posed to him. And so one of the questions that was posed to him was, can someone testify on themselves about a prohibition that would incur death? Meaning, if there's, can someone go to court and say, I committed, let's say he committed death, he killed someone. So he says, I committed the act of murder, for which the punishment is murder. Can he then go to the court and testify that he did this? Because essentially what he's saying to the court is, kill me. He's saying, I did this thing that's punishable by death. And he's pretty much saying, kill me. So the question posed was, can he do that? Because he's killing himself. And we know from the verses we mentioned earlier from Maimonides that one is not allowed to commit suicide. You're not allowed to commit suicide. So is this guy allowed to do this? And can the court work with that testimony? And the Radvaz says, no, you cannot. And the explanation he gives is because you don't own your life. That's owned by God. And that's that's a difficult thing to swallow. So if you're coming from a very secular ethics point of view, where there's autonomy and you have the right over your life, again, this will be a discussion for a later date, and it's a very in-depth discussion. But again, if you're just coming from that point of view, this is a hard thing to swallow, that God owns your life. And so I just want to elaborate here where that comes from, is that God infuses life with sanctity. And so we're always coming from a position of the sanctity of life. And so when we say God owns your life, what we're saying is that there's inherent sanctity in your life. And that's not something that you get to give up on. So in a sense, you owe God your life in that sense, that there's that sanctity that you don't get to violate. So what we're saying here is that, unlike the source we just brought earlier with the chinuch, the Machtzis Chinuch, that said that you owe it to your friend to save his life, and that's why if he doesn't want it, you don't have to give it. This is very sharply against that, saying it's not an obligation you owe to your friend, it's an obligation you have to God to preserve the sanctity of life. And so what we see is that if even a person's giving it away, you still have a responsibility to save that person's life because of the sanctity of life. And so that's what we have on the right box here on the slide. And the left box is Igros Moshe, obviously a much more modern source, Moshe Feinstein, who passed away in the 80s, so much more recent. But the same concept, he talks about the sanctity of life and how you don't owe life to your friend, you owe life to God. And so you wouldn't have the ability to just commit suicide. You wouldn't have the ability to give up on that. And your friend would still have to intervene. So based on what we just said, there's really two approaches here: the more traditional approach and the approach we brought before. So let's do a quick recap of everything. We know in black and white terms, suicide is not okay. That was brought down. We saw it. My mom brought down the verses for that. Suicide is not okay. So then the question remains: what's your role as a Jewish physician? Where do those obligations stem from? And we brought down two verses. One was "do not stand idly by," and one is returning a lost object. Now we brought one source, which was Rav Yosef Babad, who clearly stated that because we're learning it from the verse of returning an object, that if someone gives up on it, you can give up on it with them. You don't have to return it. But then we saw that the more traditional approach is not, it's not the case, and you don't owe it to your friend, you owe it to God. And so even if your friend gives up on it, you can't give up on it. And so where does that leave us, right? Presumably where that would leave us is if the more traditional approach and more people are saying that it's the latter, that you owe it to God, it seems like you would have to intervene. So let's talk in practice. In practice, how do we deal with this if there is this obligation to intervene? So we have the Shulchan Aruch, which is the commentary on what to do in practice. And Shulchan Aruch explains that we have to keep in mind there's two different types of commandments. There's positive commandments and negative commandments. And I want to just take a second to explain this, because this was always confusing to me, because when you look at a commandment at face value, it could be written in the positive or the negative. So let's say, for example, in our case of do not stand idly by, that's written in the negative, do not stand idly by. However, that could have easily been written as go save your friend, because they mean the same thing. So it's important to realize it's not like inherently in what the commandment is, but just more so on how it's written. So with that being said, he describes that if you have a positive commandment, in order to fulfill a positive commandment, one is expected, or one should really spend up to 1/5 of his wealth to fulfill that commandment. So a classic example would be, it's the holidays, it's Sukkot, right? And you have to go buy an esrog, and there's limited amount of esrogim in town. What do you have to do to make sure you get one? How far do you have to go? Potentially, you'd have to spend up to 1/5 of your wealth. However, if it's a negative commandment, for example, keeping Shabbos, it's a negative commandment, you would potentially have to spend up to your entire wealth to make sure you don't violate it. So it's don't do something. To make sure that you actually don't do that thing, you'd have to potentially spend all your wealth. So that actually makes things a little bit more difficult, because in our case, it's a negative commandment: do not stand idly by. And so in order to prevent that from happening, potentially you would be required to spend your entire wealth, which that could mean your medical license, that could mean your practice, whatever that may mean. All your wealth is all your wealth. That means there's not much that could really, stop you from having to do that. When we had this discussion in person, we did discuss that possibly if you're a medical student or a resident and you have no wealth because you have so much debt, maybe that's something to discuss. But in practice, this would not be the case. So how do we deal with that? Well, the next source is the Chassam Sofer. So he explains the guidelines behind this practice of spending a fifth of your wealth or spending all of your wealth, and he says that this does not apply to commandments or prohibitions that require you to do nothing. So what does that mean? So there could be a negative commandment that in order to not violate it means you got to do something. Or really, let me rephrase that. There could be a negative commandment that the violation of that commandment is by doing something negative. So like, don't eat pork. So if you went ahead and ate pork, you violated a negative commandment, because the commandment was a negative, don't do it, and you went ahead and did it. So if you're violating a negative commandment, but you're doing so by an action. We have another negative commandment in our case, which is do not stand idly by. But you violating this would be standing idly by, which means you're doing nothing. So he says there's a distinction between violating those two negative commandments. In the negative commandment where you're violating it by an action, that you have to spend all your wealth potentially to not violate it. Whereas if you're just doing nothing and that's the violation, then this specific guideline of spending all your wealth doesn't come into play. So that being said, in our case, yes, it is a negative commandment. However, you're not expected to put your wealth on the line to not violate it, which means that you're not expected to lose your medical license. You're not expected to put anything on the line for it, which is sort of enumerated in the left paragraph of the slide, is that you could rely on secular rules and regulations, and that's what you can really do. So just to bring it back to our case, right, in terms of the resolution, we started with a case with a patient sitting in front of us who is suffering and opted for palliative care and doesn't want any life-saving interventions. Your role as a Jewish physician, yes, there are obligations, but you're not expected to go against the secular guidelines and rules and put your medical license on the line. So when we talked about quantifying what your obligation is here, because of the nature of this commandment, the obligation is there, but you don't have to act on it. You don't have to put your medical license on the line. You don't have to put things on the line. And so we hope that that's given a little bit of clarity of the basis of where these obligations come from and the understanding of where these obligations come from. And then now, practically speaking, if this case were presented to you, you would, not have to go ahead and intervene and advocate otherwise. However, I would like to point out there's obviously a much larger discussion here in terms of when you actually have to sign the DNR, DNI, or you actually have to extubate someone or pull the plug of some sort. That's going to be a very different discussion. We're saving that for our large CME accredited event. But thank you so much to everyone watching.